So welcome to our very first session of ISCRR's Learning Series. For those who don't know me, my name is Sam Barker. I'm the Director at ISCRR. Just firstly, I wish to acknowledge the people of the Kulin Nations on whose land we meet today, or where I'm based. I pay my respects to their elders past and present, and we extend that respect to the First Nations people here today. So ISCRR's a really unique partnership between Monash University and WorkSafe Victoria. And over the past 12 years, we've had the pleasure of working with world-leading researchers around the globe in the field of workplace health and safety. And today's researcher is no exception. We're proud to be hosting the session today, our very first one, on systems thinking and workplace injury prevention. Will be presented by Associate Professor Sharon Newnam from the Monash University Accident Research Centre. Sharon is an organisational psychologist, and her research focuses on understanding the factors that influence safety performance in the workplace, both from individual characteristics of workers to the safety practices of management and beyond. We've worked on many projects with Sharon over the past 8 years that have defined safety communication in the workplace, claims management in personal injury compensation, effective employer-led prevention activities, and review of risk controls. She's a wonderful researcher, and I'm sure you will find her presentation really insightful.
Thanks, Sam, and thanks everyone for attending the session today. The systems thinking in action. So this project is related to preventing patient handling injuries in particular. So the patient handling injuries review of systems project, so that's FIRES for short, was funded by WorkSafe Victoria in 2018. So the goal of the project to start was to develop a tool to help guide manual handling coordinators in Victorian healthcare services, conduct a systems thinking review and revision of risk controls following the report of a patient, an injury to patients within a hospital setting. So this tool was developed in collaboration with us at Monash University Accident Research Centre and also the University of Sunshine Coast, and in particular WorkSafe Victoria and Victorian Public Health Services added incredible support and contribution to the project. So the FIRES tool is based on systems thinking accident analysis model called Rasmussen's risk management framework, and in particular the method, which is the AxioMap technique. We also used WorkSafe Victoria's guidance material on the review and revision of risk controls to develop the tool. So there was 5 key principles that actually went into the development of the tool as well. But in terms of the purpose, it was really designed to improve compliance with Regulation 28, optimise the risk controls to prevent patient handling injuries, optimise the allocation of resources to control the risks associated with patient handling, and to improve collaboration across all levels of the system. So I mentioned previously, it's based on that systems thinking accident analysis method, and where there was 5 key principles that were used to improve work systems to reduce the risk of injury to staff within the healthcare. So you can see here on the right-hand side, this is Rasmussen's risk management framework with the 5 different levels which we use to describe the healthcare system. And on the left-hand side, there's the 5 principles. And just going through those principles, the first one, there is focusing on a need to focus on factors at the higher levels of the system rather than on focusing on just the behaviour of staff and equipment, which is very, very much the approach given with traditional investigation tools. There is a need to improve the interaction between components of the system. And this is really identified in the figure on the right-hand side, showing those arrows going up and down the system. There is a need to improve the interaction between the components of the system. There is a need to improve flow of information up and down levels of the system. And the final one, really needing to make the system more resilient to people performing tasks in their own way and becoming more efficient over time. So really we're building that resiliency in the system itself. And of course, the final one is really about monitoring work systems. So the work systems need to have good processes in place for monitoring the implementation of the risk controls over time. So the tool itself comprises 6 different steps. So I'll just go through those steps really briefly. Step 1 involves a summary of the incident. We also ask the investigators to describe outcomes for staff and any patients, the current risk controls in place, and in addition to that, any response that's done prior to the review. Step 2 is about identifying relevant stakeholders to provide information for the review. So very much aligned with that systems thinking approach, looking to a consultation at all levels of the system, not only talking to the injured person themselves, but looking at all of those actors in the system, including even the regulators, and to provide any information to populate the tool or the incident under investigation. Step 3 involves identifying the factors contributing to the injury. And in addition to that, why risk controls were ineffective and whether better practice risk controls were available. So step 3 also includes what we refer to as the classification scheme, which includes a description or all the factors, the risk factors that are involved in patient handling injuries. And we populated that classification scheme through a review of the literature and through extensive consultation with the healthcare industry, as well as looking at WorkSafe Victoria's guidance material on risk controls. So that classification scheme provides quite a comprehensive overview of all the risks that need to be considered within any investigation at all the different levels of the system. Step 4 involves creating a visual representation of the contributing factors and the relationships. And this is where we use the Rasmussen's AXIMAP technique. And you can see here, there's a small AXIMAP which is short for accident map, which is presented in step 4. It looks like a really complex and hideously spaghetti diagram, but breaking it down, it is quite easy to understand and tells quite a nice story in terms of any incident under investigation. So step 5 and step 6 of the tools are really focusing on developing the action plan. So step 5 is about looking at the revision of risk controls within the health service. So what is in control of the health service themselves? But this step 6 is going beyond the health service and looking at revision of risk controls, identifying recommendations for external stakeholders to improve risk controls to prevent patient handling injuries. So that's looking at the role of WorkSafe Victoria and other key regulators, government bodies in the system that have the power to be able to create systemic change within the system. So we were lucky enough within this project to implement the tool and evaluate it over a 6-month period. And we did that in collaboration with the healthcare services. So what the actual implementation looked like was we first of all offered a 2-hour webinar on systems thinking and the model and method used in the development of the tool itself. That systems thinking education is really critically important in being able to provide that basis for understanding why or how this tool is different from the traditional investigation tools and why it is important to look at factors at high levels of the system. So that going down to that principle of rather than down and in, you're going up and out. So that's where you're going to create more of that systemic change within the system. Following this, we did a 4-hour workshop on systems thinking. We looked at communication styles, particularly communication styles, because looking at stakeholder consultation across all levels of the system, not only the injured person, but stakeholder consultation with senior management within healthcare services, and even as I mentioned, regulators as well. So how to look at your communication style and how to best adapt your communication style, depending on who you're asking to provide information on any incident under investigation. Following this, we did coaching sessions on completion of the first report. We found this incredibly an important stage and an educational stage in being able to provide feedback on just prompting the thoughts in terms of risk factors at higher levels of the system, relationships between those risk factors, and in particular, the generation of actions that are going to create more systemic change, as opposed to those just isolated, again, at the frontline level or equipment level. So really trying to prompt that, encourage the creation of actions that are going to create systemic change. And we found that incredibly important in those one-on-one coaching sessions. So after the training or the implementation or the training was done, the coordinators were asked to complete a minimum of 5 reviews using the tool. And that was done from July to December 2019. So overall, 16 OHS officers from 10 health services in Victoria were trained in the FIRES tool. The majority of these were metropolitan based. There was some attrition over time due to change in job roles and leaving the health services. So that we ended up having 4 that were unable to continue participation. Approximately about the coordinators reported the first investigation they did took about 2.5 hours to complete, which is quite time intensive, particularly when looking at developing that the AXIMAP itself. But once the first investigation was done, they had that consultation session and they knew what to do. They were reporting that it took them around 1 hour to complete an investigation. So what did we find from the FIRES implementation? So this figure presents the summation of all those factors contributing to patient handling injuries, which was identified in the FIRES review. So you can see in this figure that these represent those 5 levels of the system that were modified using Rasmussen's risk management framework. So starting from equipment and surrounding environment up to government regulators and external influences. And all of these factors that are identified at each level, they're the coming from the classification scheme itself. So we were able to quantify all those risk factors that were identified. And this is a figure presenting all that. So essentially, this data shows that there's a system of factors contributing to patient handling injuries. And this is really evidenced through the percentage of factors identified at each level of the system. So if you think of the traditional approach to incident investigation, it primarily resides at the operations management level and below. So you're looking at it, prompting investigation at these 3 levels, whereas the systems thinking approach to investigation of patient handling injuries prompted the investigation of factors at these 2 higher levels and more comprehensively at the operation management level too. So it was great to see from these results that there was contributing factors that were identified at operations management level with 24%, but also that governance administration 17% and the government regulators and external influences levels at 9%. So these kind of factors would not have been identified previous to the development of such a tool. So they do provide some really critical information in being able to, our end goal of creating systemic change within the system. I thought I had yes. Now this next picture is this awfully, incredibly complicated AXIMAP. So yes, I didn't put it up for the purpose of looking at the detail itself, but more the complexity of the system. So this was the implementation of the FIRES within the health service involved the presentation of an aggregate summary of all those contributing factors, as well as the relationships across all the completed the FIRES tool reviews as well. So essentially this figure, this AXIMAP, provides that aggregate AXIMAP from one of the health services that undertook 13 reviews using the FIRES tool. So this axis map highlights the complex system of factors. And by complex, I'm really focusing on looking at the relationships between factors within and across levels of the system, all of these contributing to patient handling injuries. And this is based again on that aggregate summary of 13 incidents from one of the health services. So it's really identify the multiple interacting factors within and across levels of the healthcare system. And again, reiterating the traditional investigation tools primarily focusing on these two lower levels of the system. So all of these factors and the relationships between factors would not have been identified if not prompted within an investigation tool. So this really does show support for the success of the tool in achieving a systems thinking investigation of these incidents. So this figure presents the summation of those key themes emerging from the actions generated from the FIRES review. So the actions were those step 5 and step 6, where we asked them to generate actions for internal within the health service and for external stakeholders. So as you can see here, the highest proportion of actions identified the review and revision of controls at the operations management level, which at 40% there, through strategies such as we're looking here just at promoting a safety culture and review of rostered hours and staff breaks. There was also a large number of actions identified at the governance administration level, and those 27% included strategies, again, such as creating a safety culture, introducing KPIs for staff safety. So the majority of these actions, when thinking about that stakeholder consultation in particular, targeted stakeholders internal to the health services, such as managers, directors, nurse unit managers. However, their actions also identify the role of stakeholders external to the health services, including, as I mentioned before, state-based workplace regulators, even the Department of Health. So these results suggest that the FIRES tool helped facilitate a shift in focus away from that frontline worker level towards higher managerial levels when developing the risk controls. And why that being so important is because we're going to create more systemic change if we're going to identify actions at the higher levels of the system that are capable of mitigating against pressure of the risk factors that I have a relationship with at lower levels of the system. So a smaller proportion of these actions too were also looked at the review and revision of equipment and those focused on frontline staff. So this really suggesting that the FIRES help coordinators to apply that systems thinking during the review by thinking of actions to reduce patient handling injury just beyond that staff and modifying equipment alone. So that comparison between those two levels and the higher levels really shows that the tool was capable of creating that thinking and the development of actions that were more systemic. As part of this project, we also did an evaluation of the tool, a usability evaluation. So we asked the OHS officers to complete surveys following the implementation. So effectiveness in the implementation was evaluated and coordinators strongly agreed there was value in using the tool. They also strongly agreed that they would support using the tool in the future and that it could be easily integrated within their existing work practices. And they also agreed that the feedback could be used to improve the FIRES tool. In terms of, we did the implementation within Victoria. We also did it in New South Wales, but it was good to see in Victoria here that the evaluation also identified that FIRES helped them to comply with Regulation 28(1)(c), which was one of the key goals of this project. These are some of the qualitative comments that were provided following within the evaluation. So overall, coordinators believe that the FIRES tool provided a more comprehensive approach to an investigation of the patient handling injuries, which was really promising to see. So in terms of what we found and next steps for the project itself was the feedback from the FIRES tool essentially suggested that the tool helped coordinators think in systems. And this was particularly evidenced by identifying contributing factors at the operations management level and above, and actions targeting more the systemic change in healthcare sector, which is what we wanted to achieve. There was positive support for effectiveness as evidenced through the evaluation. And the coordinators believe that the FIES is a valuable tool for investigating patient handling injuries. And it would be used within their future work practices, which we know it has been, and it has been extended, as I mentioned, beyond Victoria to New South Wales. And we got very similar results in New South Wales as we did here as well, and have been able to do some revisions to the tool since. So we also got a lot of feedback from this evaluation. And it was extremely positive, and the insights of the data have already been used to inform activities within WorkSafe, such as the review and revision of inspector training and the development of new guidance material, which was really positive to see. And as a result of the success of this project, WorkSafe have announced at the beginning of last year that they're going to support an extension of this project. So we really responded to the feedback received from the healthcare services that participated in the FIES implementation. One of the bigger things that they said in terms of negative aspects was the time taken to develop the AXI maps, so that's the visual representation of all of the factors and the relationships between factors, which is totally understandable. And we got the same feedback from the New South Wales trial as well. So WorkSafe was very responsive to that, and this funding will be used to develop a software tool to support the implementation of the tool to review all workplace incidents. So this app-based version of a systems thinking investigation tool will be launched in around March next year, and it's going to be extended beyond patient handling to all workplace incidents within the healthcare setting. So we've also developed some online training and coaching elements to go within the tool itself. So when I was mentioning previously about the training, so for example, the 1.5 hour webinar has been condensed into a 7-minute digitally animated video to look at to discuss the evolution of accident causation models and the development of the tool itself. And then separate videos have been developed on how to actually conduct each stage or each step of the tool itself. It's looking really neat, the app, what I've seen so far. So it's nearly an alpha version at the moment, so we'll be able to workshop that in the new year. But we are looking to recruit healthcare services and aged care within Victoria to participate in the trial of that tool next year. So again, the trial will involve that more comprehensive training, but the videos will also be included within the app too, if others within agencies would like to use the tool as well, such as nurse unit managers, for example. If they don't have the time to come along to the training, which would be completely understandable, those short animated videos will hopefully provide a sufficient level of education in terms of how to use the tool. So we are looking to recruit. So if there is anyone interested that would be interested in participating in the training and the implementation of this tool, the app-based version over a 2-year period, please contact me. Part of this project too is also that we're going to evaluate the cultural, safety and financial benefits of using the tool. So as I just mentioned, the implementation of this digital app will be done over a 2-year period. So we're going to be looking at the actions that are generated, particularly from these investigations or incident reviews, I should say, and to follow up to see if they've been implemented and the success of their implementation. So really exciting next steps in terms of the tool. Please, I'll stop there and welcome questions.
A question about, obviously this tool is something that has the potential, you've broadened it out around healthcare. How do you see it applying in other settings as well beyond healthcare?
Yeah, that's a great question, Sam. We're doing lots in that area, actually. And one of the bigger projects that I'm working on at the moment is that received funding from the Office of Road Safety this year to develop a systems thinking investigation tool for heavy vehicle crashes. So in the process of working with WorkSafe Victoria, which is really great to get their involvement again in really developing that classification scheme in the first instance to make sure it accurately represents the risk factors and the key actors that are involved in the transportation industry. So that's it's going to be a very similar format to what the fires and the STIR is what we're referring to as the app-based version as well. I should have said that. So systems thinking in review. So STIR app, very similar in terms of the steps taken, but modifying that classification scheme to align with the industry.
Yeah. So really, it does have that potential to be adapted across the board. That's great.
Absolutely. So beyond patient handling, we've also worked with WorkSafe Victoria in the development of a tool to investigate workplace violence in City Council and for work-related driving crashes. So they're specific for light vehicles as well. So it's very applicable across a whole range of industries. It's just making sure that stakeholder consultation framework accurately represents the actors across each of the levels, and the risk factors are there to enable that prompting of the thinking of what is this risk factor, did this risk factor contribute to the incident under investigation.
Yeah, great, thank you.
Is this tool generalizable to other workplace or industry settings?
Yes, just going on from what I was saying with Sam there, absolutely. So it's a matter of just modifying that stakeholder framework and looking at the risk factors relevant to the industry or the context or the workplace context.
You mentioned that you had to think through a whole range of communication methods. Can you talk a little bit about what they were, what worked best with each of the different cohorts?
Communication methods. Communication styles. Yeah. So what we actually did is that we looked at what most dominant communication style is, and then just reflected on the fact that sometimes needing to modify the communication styles to align with the audience that you're talking to. So talking to a colleague that you work with on a daily basis may be very different to the way that you ask questions at senior management level, which needs sort of more, I suppose, that shorter and sharper type direct responses and opportunity to provide those types of answers for them from them as well. So it's looking at what your dominant communication style is, what's the dominant communication style of typical senior level management and other types of managers, and it's just reflecting on how you could sort of modify that communication style to best get the information that you can from individuals. And why we actually included that as part of the training is that we got feedback early on in the development of this tool that sometimes it's really difficult to engage with others in the organization, including senior management, senior manager like for example, procurement managers would be an example for that. So it's just reflecting on, what communication style would be best to actually get the information that you're seeking from them. And the videos that we developed as part of the STIR tool actually goes through an example of, how these kind of communications could be facilitated with various different actors within the system.
So the next comment came through that they're interested in the response at higher levels, particularly at the governance levels, where the healthcare organisation is open to making changes in response to the findings of the investigations.
Yes, yeah. So part of the FIRES project, we didn't do an evaluation of the actions that were implemented, but we did do follow up in terms of those that had been using the tool for a while, and we did find that many of them were in progress. Many of the actions were being actioned at that point in time. The success of those actions were very varied because some were just in the implementation phase, but there were some that had actually been actioned, which was great. We saw more success, I suppose, in terms of WorkSafe Victoria looking at those results and taking them on board and modifying their inspector training and the development of guidance materials to address some of the gaps that were identified through the results of the investigation. So definitely WorkSafe Victoria took the results on board 100% from the perspective of what the results found. The healthcare services, it's for the fires project, it wasn't part of the scope, but that was part of why WorkSafe Victoria funded the ISCRR project, so the digital application, where we're going to be looking at evaluating those actions and particularly from a cultural, social, and financial perspective, and looking at those actions, were they implemented, the success in them, and was there any of improvement within any of those key indicators that we're looking at from a social, financial, social perspective.
Thanks, Sharon. Another question's come through in response to what you're talking about, how this process is undertaken in response to incidents. How does this work in embedding a more preventive approach? And you mentioned actions. Have they been evaluated for preventing injuries?
Yeah. So just going from the previous question too, so they haven't been evaluated within the scope of the fires project, but that's certainly a key aim of the ISCRR project, is to evaluate the actions. But as I've mentioned, there were some actions that were implemented within WorkSafe Victoria from the results of the fires project.
If you can reflect on the reaction from frontline workers regarding the longer time taken to complete the fires evaluation after an incident, how was that managed?
Yeah, that's an interesting question. We didn't receive any feedback that the frontline staff that were injured had any issues in terms of the prompting of more investigation. The primary focus of this investigation, though, was to go beyond the injured person. So getting that summary of the events was, I think that's pretty much the same in terms of what was done traditionally as part of investigation processes within the healthcare services. So they probably didn't go into any more additional depth in terms of questioning the injured person. But the questioning beyond the injured person is where that comprehensiveness of the fires approach really came into play. So it was asking other actors within the system, the nurse unit managers, the other managers within the healthcare service, chief procurement officer, there were senior execs that were consulted. So it was, and we're talking about the communication styles before, it was all in the framing of the questions and very much focusing on that this is a review, it's not an investigation, it's a no blame approach. It's just trying to find all of the different factors that did contribute, and there's no one factor that's going to be focused on within the incident under review, and it's going against that it's really advocating for a no blame approach to investigation. So it's all in that wording. We talk about that within the training and the communication styles and how you actually approach people in a way to actually clearly convey to them the message of what this systems thinking approach to the review is very different from the blame approach, where you're trying to find single elements within the system to change, such as focusing on training and retraining or just changes to equipment.
What advice would you give them in setting up to start developing more systems thinking approach to research?
Yeah, that's a really good question. I think it's about looking at the industry or the sector that you're going to be investigating in the first instance. So that evidence base in terms of identifying risk factors that contribute to incidents is, I think, the most important first step. And how we go about doing that is doing a systematic review of the literature. But that's going to obviously identify a lot of gaps in the system as well. And that's where that consultation with the key stakeholders stakeholders in the system is so incredibly important. We found from this project that it wouldn't have been possible without the collaboration of WorkSafe Victoria and healthcare services. We originally, as academics do, we had this 8-page version of the FIRES tool to start with, and we provided all this instruction throughout each of the pages in terms of describing what systems thinking is, why this is important. And essentially after the first phase of development, it was cut down incredibly, because the healthcare practitioners said this kind of level of detail isn't needed. The training goes through this, and we don't sort of need these constant explanations throughout, and it just makes the review a lot longer than it needs to be. So, I mean, that's just one example of the feedback that we got, and it just wouldn't have got to the stage that we got it to, this 3-page tool that was user-friendly and was considered to be comprehensive approach to investigation if it wasn't for that collaboration. So research comes into it very strongly, obviously using tools such as, systematic review of the literature and even looking at development of the AXI map itself. But that consultation and the co-design process with industry and government is so critical.
So thanks again, Sharon, for sharing your insights around how systems thinking has been used to improve worker safety. And it's really interesting how it can be applied to different settings. It's definitely a new way of working and lots of potential for improving safety into the future.